Hi, welcome to the Spring 2025 information session video. My name is Philip, and I'm the head program lead for this year. I'm excited to talk about what Emergency Medicine Research Associates is and how you can get involved. So you may have a question regarding EMRA's purpose. Why does EMRA exist? Well, we serve as a net that catches patients entering the ED. We assess patients' medical information to determine which patients can be enrolled into emergency medicine's ongoing studies. Currently, our members are screening for 4 different studies, which you will hear more about today. Now let's talk about the vision and mission for the program. So our vision is to advance the practice of emergency medicine through clinical research and develop the next generation of responsible leaders in healthcare. Our mission is to meaningfully assist with ED faculty-conducted clinical studies and equitably create a culture of continuous learning and professional development among volunteers by offering opportunities for research, clinical experience, mentorship, and collaboration. We have some amazing faculty sponsors, including Dr. Maurer, Dr. Hendy, Dr. Cooper, Dr. Schreiger, and other David Geffen School of Medicine faculty, residents, and fellows. So this is our wonderful team of EMRA volunteers. We're a dedicated team of 45 to 55 volunteers, and we serve as the eyes and ears of the UCLA Emergency Department Clinical Research Division.
Hi, everybody. My name's Andrew, and I'm also one of the program leads. I will now be going over what we are not as a program to further delineate our roles. As EMRAs, we are fortunate to have many opportunities and responsibilities within our program. Though we are afforded access to the Ronald Reagan Medical Center and the Emergency Department, it is important to note that we are not healthcare professionals. As such, our activities cannot infringe on aspects of patient care. We are not healthcare providers, and thus we do not provide medical advice nor perform any procedures on patients. Additionally, we are lucky to work with many research experts. However, we ourselves are not experts. Due to the intensive nature of the research we perform, we do not generally engage in data interpretation and analysis. With that said, EMRA offers multiple opportunities for clinical research exposure and research as our faculty sponsors and staff clinical research team understand and heavily support research associate involvement whenever applicable.
Hello, everyone. My name is Anaya Story. I'm also one of the program leads with EMRA, and I'm now going to spend some time talking about our duties. As EMRAs, we play a very important role in the execution of clinical research here at UCLA Ronald Reagan Medical Center. Currently, we're involved in many ongoing studies, and although they each have their own specific protocol and guidelines, what I'm going to mention here is for the most part universal and is at the core of what we do. We screen for qualifying patients, communicate with healthcare staff to determine patient eligibility, assist in obtaining informed consent from patients, and for some studies, we collect data. Overall, your duties here at EMRA will allow you to learn many skills that can be carried forward to a future in healthcare, academia, or industry. And I'm sure you're all wondering what EMRA has to offer you as a potential member. And some of the components of the EMRA experience, quote unquote, include exposure to clinical research, shadowing, and opportunities for professional growth. EMRA is also a platform for members to grow and to pursue different endeavors through our many committees. As you can see, we offer a range of other resources that serve our members. A few include emergency medicine conferences, physician mentorship, and amazing, helpful peers who also share a passion for healthcare.
Hey everyone, my name is Renat Petrevu. I'm also one of the program leads here at EMRA. We'll now be talking about the various types of completed studies EMRAs have been involved in. So EMRAs play a crucial role in the clinical research conducted by UCLA's Department of Emergency Medicine. In many of our multi-center studies, UCLA stands out as the top enrolling site, so with EMRAs managing the entire patient screening process. The following are just a few examples of the numerous studies that we have heavily relied on for the contributions of EMRAs. One study focused on the evaluating various treatment strategies for sepsis, with EMRAs closely monitoring patient vitals and working in real time with the care team to identify eligible participants. In the outpatient VTE study, which is venous thromboembolism management study, we examined the effectiveness of different anticoagulants. EMRAs were responsible for identifying and obtaining formal consent from patients. Another study called Whole Blood explored the benefits of using whole blood over blood components during massive transfusions, with EMRAs collecting blood samples and conducting clotting assays. Additionally, a group of EMRAs published a journal article outlining the history and the impact of the EMRA program, and their contributions have been acknowledged in other scholarly publications. Overall, EMRA has a long-standing and significant role in facilitating clinical research, both in past studies and ongoing projects that we have currently. The other cores will be speaking more about specific studies.
Hi everyone, my name is Kush and I'll be talking to you all about ASTER. So ASTER was a multi-center interventional trial enrolling critically ill septic patients. Sepsis is a life-threatening condition involving a dysfunctional systemic immune response to infection. As a part of this dysfunction, excessive inflammatory signals and oxidative damage occur, causing bulk cellular injury to escalate to organ damage and failure. Acetaminophen may reduce some aspects of these pathways and oxidative stress and sepsis. In order to formally investigate this, Astor assessed the efficacy of an acetaminophen infusion for minimizing organ failure and extending days alive in patients with acute presentations of sepsis-induced major organ failure. In this study, EMRAs gathered detailed medical information across multiple stages of a patient's admission while coordinating with nurses to identify those patients who may qualify.
Hi everyone, my name is Rachel Wang, another one of the program leads here at EMRA. I'll be moving on to another brief description of one of our completed studies here called IMPALA, also known as Emergency Department Initiative Palliative Care. IMPALA has been shown to improve patient-centered outcomes in older adults with serious life-limiting illnesses. However, the optimal modality for providing such interventions is unknown. Impala is a two-arm, multi-site, randomized control trial that seeks to investigate how different forms of palliative care can impact patient and caregiver burden and outcomes. Specifically, the study compares nurse-led telephonic care management to outpatient palliative care for adults with serious illnesses.
Hi everyone, my name is Grace Lalani and I'm another one of the program leads. We're now going to move into talking about EMRA's current study. The first study we're going to talk about is developing a decision instrument to guide selective abdominal and pelvic imaging of blunt trauma patients, which is a study we refer to as ABCT. CT scans are one of the main methods for evaluating incoming trauma patients due to the clinically challenging nature of gauging blunt abdominal injury externally. And out of fear of missing injuries, physicians often CT scan the majority of incoming traumas, but this conservative approach only catches injuries in a few cases while exposing patients to excess radiation and costing the hospital an immense amount of resources, time, and healthcare expenditure. Thus, the study aims to establish a clinical decision instrument tool for physician use during traumas to determine whether a CT scan is necessary. ABCT is largely an observational and evaluation-based study where EMRAs have an important role in extracting data through incoming non-penetrating blunt traumas. EMRAs assist in the completion of the ABCT questionnaire, which is the proposed clinical decision instrument that can help reduce this excess radiation exposure. The two components of the study's questionnaire, both the resident completed section and the EMRA abstracted data for each enrolled trauma, are then logged into our database by EMRAs. The study is especially interesting because it's a high volume study and EMRAs have the opportunity to witness the trauma team manage incoming patients at a level 1 trauma center while gaining exposure to the fast-paced environment of the emergency department.
Now I'll discuss IceCap, or influence of cooling duration on efficacy in cardiac arrest patients. So over 380,000 patients suffer from out-of-hospital cardiac arrests in the US annually. Protecting the brain from ischemia, or a lack of blood flow, during cardiac arrest is extremely important. Prolonged ischemia can lead to devastating neurological deficits. Cooling in comatose cardiac arrest patients with shockable rhythms has been thought to improve neurological outcomes. And this brings us to IceCap, a multi-center randomized clinical trial which aims to determine if increasing duration of cooling to induce hypothermia is associated with better neurological outcomes. The trial also aims to identify the optimal duration of cooling. As EMRAs, we will be screening for potential post-cardiac arrest patients and assessing if they are eligible for the study based on multiple factors.
All right, next we'll be talking about the fentanyl study, which is EMRA's opioid overdose research study that aims to predict the medical consequences of novel fentanyl analog overdose using the Toxicology Investigators Consortium. This is a multi-center observational study that analyzes fentanyl overdose in the emergency department. Fentanyl is a powerful opioid, and its analogs, otherwise called fentanylogs, are unregulated and heavily abused, leading to preventable cases of overdose in many communities. Since the number of drug overdoses from these novel psychoactive substances have increased over the past few years, this study aims to identify and quantify the intake of fentanyl among patients presenting with an overdose to the ED, along with evaluating the consequences of fentanyl overdose and geolocating any trends regarding this outbreak. Our role is that EMRA screen for patients with relevant chief complaints and identify patients through their blood samples who present to the ED with psychoactive substance overdose. We then immediately alert our PI, Dr. Levine, who will enroll the patient. As a subset of this study, there is also a behind-the-scenes enrollment in the DOT surveillance study, which aims to learn more about missed opportunities for prevention, effective treatment of a novel opioid and stimulant overdose, and targeted interventions of those groups that are at the highest risk of being affected by this crisis.
Hey everyone, I'm Sophia and I'm also one of the program leads. I'll now be talking about YPIC, which is our study on youth partners in care for suicide prevention. Adolescent suicide is the second leading cause of death among U.S. youth ages 13 to 24. Youth with serious suicidal behavior or thoughts often present to the emergency department, but evidence is limited regarding optimal interventions for reducing their risk of future suicide attempts. The purpose of this study is to compare two evidence-based interventions to see which one is more effective for reducing suicide attempts. The first is Safety Acute, or Safety A, which is a crisis therapy session focused only in the ED. The second intervention is Safety A with CLASP, or the Coping Long-Term with Active Suicide Program, which is comprised of brief therapeutic follow-up contacts after discharge from the ED or hospital. Our role as EMRAs is to screen the ED track board to identify eligible patients who present to the ED with suicidal ideation or behavior and notify the SRAs about enrolling these patients.
We will now be going over the committees that we have in EMRA. The work that these committees do are a big part of this program, and members are welcome to join whichever committees whose work they feel passionate about. So the first committee that we'll be going over is the Research Committee. The Research Committee is one of EMRA's oldest committees, and it focuses on providing a space for EMRA members to further their knowledge of clinical research and discuss topics that they're particularly interested in. At the heart of the Research Committee is our journal clubs, which we hold 4 times per quarter. Here, members have the opportunity to present on recently published papers about any topic in clinical research that they're interested in, and as a group, we discuss the paper's methods and findings, as well as their limitations. We also have other opportunities for members, such as presentations at UCLA's Undergraduate Research Week Poster Day. Members additionally have the opportunity to join resident journal clubs to learn and engage with cutting-edge research directly from ED residents and attendings. Lastly, exceptionally committed members are sometimes given the opportunity to engage in projects with EM faculty. Overall, the Research Committee is a great place for growth and development of EMRA's research knowledge.
Hi, my name is Angela Yang, and I'm one of the other program leads. So I'm just going to talk a little bit more about New Member Training Committee. So New Member Training Committee serves to equip our new EMRAs with the knowledge and skills to function independently on shifts as clinical research associates in the emergency department. After every recruitment cycle, experienced members will volunteer their time to be trainers for our newer cohort, and our trainers teach our trainees the skills that they need to succeed on shift. And we also test their knowledge and performance of our study protocols. The training shifts will occur during the weekly 4-hour shift in the hospital, and these are preceded by an onboarding meeting for training orientation. Overall, the goal of new member training committee is to standardize and streamline our training process so that each member has a quality and equal training experience to adequately prepare them to benefit from their time on shift.
The next committee we're going to be talking about is Mentorship Committee. Mentorship Committee is actually one of the largest EMRA committees, which started out with simply pairing up younger EMRAs with senior members in our mentor-mentee pairings every quarter, which eventually expanded to alumni mentorship pairings and now resident mentorship pairings as well. Mentorship Committee now encompasses a variety of professional and personal development resources, workshops, and opportunities for EMRA members. Mentorship Committee facilitates greater connection with the physicians at Ronald Reagan through different avenues as well, such as shadowing shifts, which is a privilege of attending, as well as privilege of attending EM resident conferences alongside the faculty, and a resident EMRA mentorship pairing program. Recently, we've been able to expand the offering to a 10-week high school mentorship program to schools in our Los Angeles community, where we hold sessions every week and provide mentorship to students seeking a higher education. Overall, the goal of Mentorship Committee is to help bridge the gap between pre-health students and the careers they aspire to be by connecting them with practicing healthcare professionals through the facilitation of shadowing, mentorship, and educational and professional development opportunities.
Mentorship Committee also puts on a variety of seasonal programming and workshops throughout the academic year for members, such as case competitions, pre-med workshops like for MCAT prep, seminars like Women in Medicine, the pre-med resource folder, and more. Our ultimate goal is to both foster greater connection between our members and the ED and to grow them in their strengths and professional aspirations. We want our members to be well educated, well informed, and well rounded in all facets of their pre-med journey.
Great. Now moving on to Health Literacy and Outreach Committee. HALO allows EMRAs to utilize their creative, organizational, and educational skills to produce meaningful educational projects in line with EMRA's vision, whether it be through empowering and educating patients at health fairs that we attend, or developing infographics and videos that we publicize on our Instagram. We host unique events for the UCLA student body and organize special projects, like our outreach to different patient populations at different centers and our ED encyclopedia. HALO Committee allows EMRA members to leverage their unique skill sets to grow the population in the organizations and themselves. We hold meetings every quarter, and commitment is project-based, so it's dependent on which project you are active in, but the committee aims to promote EMRA's vision while providing members the opportunity to educate the community about pertinent health issues.
Now I'll be talking about the Education Committee. The purpose of the Education Committee is to oversee a variety of opportunities and projects for EMRAs and the public. We hope to educate more about the healthcare topics and its intersection with other medicine adjacent fields through different events. Now I'll be talking about a couple of projects that we've had before. In previous quarters, we had a healthcare discussions event where EMRAs shared their experience in healthcare so that us as EMRAs could better understand each other's motivation in going into the healthcare field. We also had a healthcare insurance workshop so that people would become more informed on how healthcare insurance works for different individuals depending on their plan. We also work on education modules for the studies we help to screen for, and in joining this committee, you'll get a holistic view on the purposes of our studies. There's also one main project chosen to be carried out per quarter, and there are many opportunities for leadership in specific areas of interest. The time commitment regarding this committee is that we have one scheduled general meeting, and members choose how much time they want to devote to their projects and schedule their own meetings with their team.
So you may be wondering, what exactly are we looking for in applicants? First, we're looking for passion. We seek individuals who are passionate about medicine and healthcare and about the research that we do in the hospital, as well as the specifics of our program and the elements that make us stand out from other organizations on campus. We're looking for dedication and reliability. We look for individuals who fulfill their responsibilities in a timely manner and are reliable on their shifts and as well as in their committee tasks. We look for interpersonal and communication skills. When you're in the emergency room, you need to effectively communicate with healthcare professionals, even in stressful situations. And that's why those interpersonal skills are very, very important. We seek professionalism. Being able to conduct yourself professionally is essential not only to being a stellar member of this organization, but also for a future career in healthcare. We look for attention to detail. We're looking for individuals who take on different opportunities to make the most of their experience and who show attention to detail in every task that they take on. And finally, we seek applicants who make good judgment calls, whether that be inside or outside of the hospital.
Hi everyone, my name is Eduarda and I'm one of the EMRA program leads. EMRA has 1 year time commitment beginning at the completion of your training, including all holidays and school breaks. This equates to 6 hours a week, which includes a 4-hour hospital shift working in Ronald Reagan Medical Center, 2 hours of staying up to date on studies, and lastly, EMRAs are required to attend 2 general meetings per quarter. Outside of these hours, general members have the opportunity to get involved with committees and take initiative by leading projects they are passionate about. We strongly encourage our members to be more involved because it's an excellent opportunity to grow both personally and professionally, but they also have the flexibility to take on as much or as little as they like, as long as they are meeting the hour commitments listed on the slide. Now, as we've mentioned throughout this presentation, EMRA is a program that runs year-round, which means members are responsible for summer, winter, and spring break shifts. So if you are an international student or you are worried about not being able to go home, we want to assure you we do have solutions. Members often double up shifts or cover each other's shifts so they can take a few weeks off from shift duties. Lastly, we want to emphasize that deferrals of admissions are not allowed. If you are accepted into the program, the onboarding and training processes begin as soon as you receive the acceptance email, so please do keep that in mind.
Well, I'll be talking about some of the factors surrounding how you can get involved. Firstly, the number of people we accept varies depending on the current size of the program that particular cycle. This is in no way to make the program more exclusive or less accessible to students. A lot of the resources we offer are dependent on external factors. Our working together with the emergency department dictates how many members we can have that can be trained extensively to do the work we do. Members are accepted into the program officially when they have been trained in the emergency department and have shown their ability to carry out shift duties required of an EMRA. We also like to emphasize that reapplicants are highly encouraged. We look favorably at reapplicants as they have put in the time and effort to apply into our program, even if we are not able to accept them the first time.
The UCLA Health Volunteer Office requires a few things from all of its programs. Members are required to have an updated tuberculosis vaccination or a TB blood test within the past year. Also, if you're currently part of another UCLA Health volunteer program, such as a lab, care extenders, or any other UCLA Health affiliated program, we ask that you get a reference letter from your program coordinator to make sure you're in good standing with the program and that you are okay with being in more than one program at once. You must also have completed the minimum requirement for your program before applying to EMRA, which is usually around 50 hours minimum, but can vary. And lastly, you must be at least 18 years old to apply.
As for our application process, our application will open on Friday, April 11th at 11:59 p.m. The link can be accessed through our link tree, which can be found in our Instagram bio at EMRA UCLA. The application will close exactly a week later on Friday, April 18th, also at 11:59 p.m. And unfortunately, no late applications will be accepted, so please try your best to submit your application at least 30 minutes ahead of time. If you have any questions, concerns, or significant obstacles regarding this application process, please let the coordinator team know, and we will do our best to address them. We would also like to note that we do review our applicants holistically, and GPA is not a screening factor. What this means is that we consider individual experiences, character, and values rather than a skill set someone may or may not have. We will also be requiring contact information for 2 to 3 references this cycle. For more information about the initial stages of the application process, please email us or DM us on our Instagram account. I'll also go into the interview process. For the spring 2025 cycle, primary interviews will be conducted via Zoom, and secondary interviews will be conducted in person. Decisions for primary interview invites will be sent out by April 27th, and decisions for secondary interviews will be sent out by May 4th. Please note that prior research and/or medical experiences are not required to apply to our program. We want to emphasize that we evaluate applicants in a holistic manner and based on their meaningful experiences. So whether those be academic, personal, or otherwise, we are here to understand your story and not filter applicants based on specific qualifications.
To stay up to date with our recruitment process, make sure to follow us on Instagram. Either use this QR code here or follow us directly at EMRA UCLA. If you have any questions, please submit them to this form using this link, and we'll try to answer them during our live Q&As. Also, feel free to direct questions to our email, uclaemrastaff@mednet.ucla.edu.
Thank you for your time. If you have any remaining questions, please join us at our Q&A info sessions virtually on Monday, April 7th, and in person on Wednesday, April 9th. We look forward to reading your application soon.